At Sickle Cell Central, we believe that self-care and well-being are a shared responsibility between communities and services throughout social prescribing pathways. By harnessing the power of creativity, cultural messengers, and professional collaboration, we can deepen public understanding, strengthen trust, and improve the quality of cultural care. Our approach supports neighborhood research hubs for health equity that strengthen representation, communication, accountability, and assurance across services and community research ecosystems. Sickle Cell Central is a faith research network initiative.
Hello and welcome. And I'm really pleased today we have Calvin Campbell, who is a senior community engagement ambassador for NHSBT. Calvin, how are you doing?
I'm good, thank you. And thank you for having me.
Okay, good to see you again. So Calvin, over the past decade,
Yes.
we have seen a significant progress in sickle cell care, including greater public awareness, improved treatments, and increased participation in clinical research,
Yeah.
and of course, clinical trials. Many individuals and families are now benefiting from the advances that were simply just not available just a generation ago. From your perspective, what has been the most important milestones, and where should the next wave of innovation be focused?
Okay, I think the most important milestones for the treatment generally of sickle cell is transfusions and exchanges and blood. There are others. Hydroxyurea is a good one, and also now stem cell and bone marrow transplant. But mainly, I think the most stable is transfusions, and for those that can have it, red cell exchanges, where you're taking off and giving people blood at the same time. And the improvement that's just happened within that, the safety, the confidence that people can have that when they get blood, it is very unlikely that they'll have a reaction. And people that used to have a reaction quite often before, yeah, it doesn't happen that very often anymore. And I think that's the biggest innovation, and it actually is giving people back their life, as it were.
Excellent, excellent. And of course, there is sometimes uncertainty within communities about clinical research and, of course, clinical trials.
Yeah.
Yet we are seeing growing evidence, as you kind of stated, that research participation is actually helping to improve treatment options, quality of life, and of course, long-term outcomes for
Yes.
people living with sickle cell. What would you like patients, families, and communities to understand about the role that research can play in shaping the future of care?
Research is incredibly important, especially when it comes to sickle cell treatment, because there are only two real effective treatments that are available to most people with sickle cell, which is either hydroxyurea, hydroxycarbamide, or transfusions and red cell exchanges. And research is important. And I know within the community, and I've often felt it, that we were used as guinea pigs, so to speak, where we'd be asked to take part in trials for various drugs and various different treatments, and then nothing would come of it. So that sense of feeling like a guinea pig grew. And I've been part of many trials and many different things that nothing has come of. So I know exactly why people would think that. But it doesn't mean that we should stop, because the innovations that we have now and some of the treatments that we have now, the improvements in treatments that we've been having wouldn't have come around if people didn't keep going and try to improve those things and research better treatments, to be honest.
Okay, yeah, that's good to hear. And of course, we always talk about evidence begins with experience. And so sometimes it's just necessary to go through that experience to make progress.
Absolutely. And it's important that people who are taking part in trials and who have various treatments like myself, and why I'm quite willing to share my lived experience.
Yeah.
Because one, I want not only the community within sickle cell, but I want the general public to understand properly what sickle cell is. It isn't just pain. It's a whole host of things. And the various treatments, needing to have ferry scans, MRIs, CT scans, and things like that regularly to make sure that you're healthy. and to keep a check on you, regular eye tests. So unless within the community and generally people are aware of those things, they themselves don't know that it happens. When they're asked by doctors, you know, we need to do this test on you, but if they've never seen anybody else having such a test or having procedures, they think to themselves, well, why am I being asked to do this? You know, and then that sense of, am I being used as a guinea pig comes up again. So the more people within the community share their experiences and say, no, this is quite normal. You know, so every time I've had an MRI scan, a CT scan, an eye test, or various treatments, I'm willing to share it so that people know that certain things are quite normal. And then obviously lessen the fear factor around that. And also then improve treatment for the younger patients coming up, knowing that there is certain types of treatments that they are available to them, and that there are tests that doctors are willing to do to keep them healthier than, say, many years ago. 10, 20 years ago, some of the things that I tested and things that I have now weren't as widely available and would be few and far between. Now it's quite regular.
Excellent. And in fact, what we'll probably do in a future program,
Yeah,
because you've touched on one of the areas for Sickle Cell Central, is to focus on the actual care pathways themselves. So with
absolutely.
other long-term conditions such as prostate and heart health, we've spoken to the surgeons, the heart surgeons, the urologists,
Yeah,
because it's important to dismantle the myths as it relates to the care pathway itself.
yeah.
And there's another important point that you made, Calvin. There's a term we use. We talk about the patient journey begins in the home,
Yes.
and every contact matters with the family, the communities, our safe spaces, and this is, of course, where the Faith Research Network comes in. Also, our professionals. It's important they take their health messages home back to their communities. So again, there's this focus on a health equity approach because we have massive amount of assets within our own communities. So I think that's definitely another area we will have a dialogue on. What are those assets? What are those community assets? You know, because with NIHR, we're about to start mapping the community assets as it relates to those faith organizations who are actually involved in community research, acting as hubs, acting as safe spaces for people with any long-term conditions, particularly from the African and Caribbean population groups. So, and our three priority long-term conditions are sickle cell, prostate, and maternal and productive health. And of course, there's a relationship with all of those. You could be a sickler with all those challenges, high risk pregnancies. Yeah, yeah.
People think because you have sickle, you aren't going to get these other issues. You know, you're not going to have to worry about cancer, prostate cancer, or any other illness. You know, I also have diabetes and epilepsy. But the key thing is knowledge and education. So the more you're aware of what can happen, the more you're aware of the various treatments and how the illness affects you, and the best way to manage your care and your health personally, and where to go if you have an issue, and to not sort of hide it, because we do tend to hide, not just within the Black and African Caribbean community, but generally, especially men, hide the fact that if we have an issue, we'll sweep it under the rug and say, oh no, I won't bother anybody. But you should go and seek help, go and see a physician and get advice. And if you feel that especially now, there are lots of places where you can get help and advice, sensible advice about sickle cell. So the Sickle Cell Society UK, NHS website, NHSBT website, and other organizations like myself, Red Cells or Us, who are out there educating people on the facts and dispelling the myths about sickle cell. And there's several people out there who do a really good job at that. And so the more you know about, one, how it affects you, the treatment, how the various things that can happen, because not everyone is the same. It's not a one glove fits all type of thing. The better you'll have, life you'll have, and the longer life you'll have.
Absolutely. And what you've kind of articulated there, we term as there's a shared responsibility for self-care and well-being,
Yes.
because that's really important. So, Calvin, of course, there is an awareness of the need for more blood, stem cell, and organ donors from
Yes.
the African and Caribbean population groups. It has increased considerably in recent years. But what do you see as the key successes from this work? And how can we build on that progress to ensure a sustainable donor base for future generations?
It has increased, but it still has a long way to go.
Mhm.
So sickle cell is the UK's largest genetically inherited disorder and the world's largest inherited disorder. And many of us rely on regular blood donations, like myself, who have red cell exchanges. In every exchange, I receive between 10 to 12 units of blood. It takes an average of 138 people a year to keep me alive.
Mhm.
In the past 7 weeks alone, I've had 36 units of blood.
Yeah.
It's an awful lot of blood. I'm having another exchange next week. And the problem is that the donor population within the Black and brown community is around 3.5%, 4%. Organ donation, other organ donation is less than that. But you have an illness that affects more people than anybody else, than any other group. And it's not just a quote unquote Black or brown illness. It affects every group. It's more prominent within the Black and brown community, i.e. the African and Asian community are the two largest groups worldwide. And if you're having more and more people who are being treated successfully with transfusions and particular exchanges, which require more blood and more often, you need more people to become blood donors and to regularly become blood donors and to dispel the myths about what do they do with your blood, what do they do with your organs. With every donation that you give, you literally save 3 adults or up to 6 children. And it takes roughly 10 to 12 minutes to donate a single unit of blood. Think about that. In 12 minutes, it took you longer to decide what you're going to wear today. You would spend longer in a coffee shop. You would spend longer watching an episode of your favorite soap. And it's quick, simple, and it's painless. But the benefits you give, I literally am sitting here talking to you now because of people donating. People that have no idea who I am, will never meet me. But the gift that they've given helps me to stay healthier. And whereas prior to me having regular exchanges, I was spending an average, say, 7 to 8 months a year, each and every single year, in hospital as an inpatient. If you had said to me prior to this, I'll meet you for a coffee tomorrow or next week, I would have said yes, but couldn't guarantee I would be there to meet you for coffee. I'd probably be in hospital. Now, if you said to me, oh, I'll meet you for coffee next month, more often than not, I can guarantee that I'll actually be there. And I can only do that because of regular donations. So we need people to realize that the fact that to which where they get their information, if you want to know what happens to blood donation, go to our website, nhsblood.co.uk, or the NHS website, go to the Sickle Cell Society website. There are official websites that will give you all the information that you need. And I urge you to stop getting their information off a place like WhatsApp and just hearsay. And I understand that there is also an historical mistrust of the NHS and things that have happened in the past. But then I say to people, okay, if you broke your leg, would you sit at home with a broken leg and say, I don't trust doctors, so I'm going to sit here with a broken leg? Or would you take yourself to the hospital? You take yourself to the hospital. So it doesn't prevent you from being sensible to caring yourself if you've hurt yourself. So why would it prevent you from helping someone that you don't know and someone that's possibly from your community? Something that literally takes 12 minutes of your life. And it's simple. People who are afraid of needles. And often people say, I don't like needles. But they're telling me that whilst they have tattoos or piercings. You know, I've lost count of the number of people that are covered in tattoos and piercing and tell me that they're afraid of needles. And I say to them, but you have tattoos and piercings. Stubbing your toe literally hurts more than that tiny needle, which is like that. It's gone and you don't even know it. And everybody that I've ever talked to, and I mean ever talked to, that's given blood, said they feel euphoric. It's the best thing that they've ever done and wish they had done it sooner. I've yet to meet anybody, and I mean anybody, that said to me that they've donated blood and regretted it. That's never the message that they give afterwards. So I want people to understand that we need it. And not, more importantly, your blood has to be a perfect match. So every time I receive blood, I have to have something called a cross match, where they match my blood to the donor's blood. And it has to be a 99.9999999% perfect match, or I will have a reaction to the blood, to the donor blood. Every time I have a reaction, I build up particular antibodies. And if you build up too many of those antibodies, you can no longer have blood. So for someone like me and others who I've known that sadly pass away, it is literally a death sentence. So we need people, when they hear this thing saying, better ethnically matched blood, I can receive blood from anyone that's in my blood group and subtype, but it's a closer and better match if it comes from someone of my ethnicity. Also, the fact that the RO subtype, which some people may have heard of, which is one of the subtypes within the blood groups, and 53% of the Black and brown community carry the RO subtype, and the RO subtype is on all the plus blood groups. So O positive, B positive, A positive, AB positive. And whenever I receive blood from the RO subtype, it means the blood is more beneficial. It lessens the chance of me having a reaction to the blood. And so if you're an RO subtype, or whatever race you are, your blood is always going to go to someone with sickle cell. And we need more people to not just register and donate one, to continually donate. Men can donate up to 4 times a year, women up to 3 times a year. And the reason that is because men have a naturally higher iron level than women, and women of color have a naturally lower iron level than other women of other races, which is often why people find difficulty when they go to donate and they've been told that their iron levels are slightly too low. And it's for safety reasons, because if your iron level's too low, once they start taking blood, you'll faint. And then we can't use your blood. It's embarrassing for everybody. And you can change that with your diet, eating more green vegetables and just changing a few things, and then you'll be fine.
Yeah, thanks for that. Calvin, your work spans NHS blood and transplant research networks, charities, patient groups, and industry partners. How important are these collaborations in accelerating improvements in patient care, research participation, and of course, health outcomes, as you kind of alluded to?
It's incredibly important, because the more people that see and hear the message, and the more people that get to speak to it and hear from someone like me, who not only works with NHS, but has lived experience, the better it is. So 10, 20 years ago, having conversations on TV, in the media, or speaking to a wider public would have been very hard to do.
Yeah.
Now I get to speak to sometimes millions of people, either on TV interviews or radio. It's coming Monday. I'm on Eddie Nessa's show, Trends at 12.
Right.
Opportunities like that means that the message gets out, and the more people know about what sickle cell is, and you dispel the myths about what it is and what it isn't, and then educate people about the things that can happen and what they should look out for and why certain things are important, like blood and organ donation, the better it is. Working with drug companies and other organizations, as I do, where if they're developing new treatments and new drugs, and they want to get my perspective as someone who not only works with NHS, but has lived experience of which roads they should go down, things that they should avoid, best ways to avoid people feeling like a guinea pig and things like that. And you have a voice. So you can only influence a room if you're in that room. I can't influence any room outside organizations. The fact that people are willing to put more money into research now because of that, where especially the larger drug companies, where years ago, even with the size of the population of people with sickle cell, they were thought, does it make financial sense? Now they see the benefits of it, because it's actually cheaper to keep me out of hospital, even with an expensive treatment. I remember a few years ago, someone said to me there was a treatment where it cost £1 million per treatment. And they said, that's a lot of money. I said, well, keeping me in hospital costs even more. If I'm spending, I once spent over 2 years in hospital. A hospital bed is over £2,000 just to sit in the bed. I take a host of medication. Some of the medication I take, sometimes 4 or 5 times a day, £100 per tablet. It costs a heck of a lot more to keep me in hospital, for me to be unwell, than it is to treat me and keep me out of hospital and keep me relatively healthy. Then I'm able to give back. I'm able to work. I'm able to pay taxes, be more productive. All those things count.
And finally, Calvin, if we were having this conversation 5 years from now,
Yeah.
so that would be what, 2031?
Yep.
We'll be there sooner than we think.
Yeah. Time flies.
What achievements would you hope to see in sickle cell care, blood donation, research participation, and community engagement? And what actions are needed today to make that future a reality?
I would like to start from school and education, and having people educated very young about what sickle cell is and what it is not. Because we educate people about a whole host of manner of illnesses and various things to watch out for. There are TV programs. You see people going on TV, celebrities saying, I'm raising funds for this charity or for this illness. I want to see sickle cell being treated in the same space.
Yeah.
Considering it affects, in fact, the only thing that affects more people on this planet is cancer. But yet, the message that gets out with sickle cell doesn't compare to the number of people that have sickle cell.
Of course.
I want to start with the education so that people are aware, because the better educated you are about what it is and how to look after yourself, the more people will avoid being too ill and being able to be productive members of society. Also, organizations, large organizations, politicians, being willing to stand up and fight for sickle cell and say, okay, we're not going to treat it as a quote unquote niche illness that only affects a handful of people.
Mainstream.
Yeah, we're going to give it the respect and the time that it deserves. The fact that we still pay for our prescriptions.
And the resources, yeah. Could you talk a bit more about that as it relates to the payment for prescriptions?
Because when it comes to paying prescriptions, the argument is given that apparently not enough people suffer with sickle cell, and it's not deemed important enough to give us free prescriptions. I get free prescriptions because I have epilepsy. Epilepsy affects far fewer people. I get free prescriptions because I have diabetes. Diabetes affects far fewer people. I don't get free prescriptions because I have sickle cell, which affects more people in this country than anything else, which is a mindset and something that we have to change.
Yeah.
And the fact that politicians, organizations, how we treat people in education, the fact that schools, colleges, and universities have to realize if you have someone who's learning, who has sickle cell, and who may take a lot of time off because they're unwell, they're not skiving. Someone is not stupid because that myth of the fact that you're not. I know lots of people who've gone to college or university who have sickle cell, have degrees.
Yeah.
Having sickle cell does not make one stupid or unintelligent. The general conversation in society, the fact that I want more people to hear it on TV and on news and in daily conversation as they would any other illness. In the same way they hear cancer being spoken about, in the same way they hear MMD being spoken about, which affects way less people. But yet the profile it gets, I'm not saying it shouldn't, the profile it gets in comparison to what sickle cell gets is not comparable. I want sickle cell to be part of our regular conversation and people to not feel embarrassed, which is also another thing. People feeling embarrassed that they have to hide their illnesses because they're going to be judged. People are going to see you as somehow weak, not worthy, because you have sickle cell, because you have this thing that they don't understand. You look healthy. First thing you hear from someone says to you, oh, you look well. How I look bears no bearing on what I'm going through physically.
how you feel.
All the time, 24 hours a day. There's nothing about how I look that tells you that I'm in pain, that I rely on morphine
Yeah.
to stay relatively comfortable, not pain-free, but comfortable to be able to do my job. There's nothing about that. So the more it's spoken about, the more it's seen in a regular conversation, all the myths and all the misinformation that you hear about sickle and people who suffer with sickle cell.
Well, it certainly starts within our communities. Going back to my point, the patient journey begins in our home. Every contact matters with our families, friends, communities, the places where we go, culture, sports. So in a sense, and I really get the message, it really does start with us and the wider society, but we've got to play our role in terms of representation. And you've done that very well over the years. I've seen your work, so, congratulations once again. And if anybody wants to connect direct to you, how would they get hold of you?
So I'm on all forms of social media. You can see me at Calvin Campbell, Calvin Campbell 64, or I work at NHS Blood and Transplant. So just go to our website, blood.co.uk. There's information about me, information about sickle cell. I'm everywhere. So I'm not hard to find. So if you're on social media platforms, Instagram, Twitter, TikTok, Facebook, you'll see me. LinkedIn,
they'll find you. They'll find you on there. I know that for sure.
Absolutely. And
okay.
Feel free to reach out. Feel free to reach out if you don't know. There's no such thing as a stupid question. First, you say to people, there is no such thing as a stupid question. If you don't know, the only way you're going to find out and get the correct information is by asking. So I never mind people asking me a question. It's the only way they're going to find out what is and what isn't.
Thank you. And take care and see you again soon.
Thank you. And thank you for having me. It's been a pleasure.
Thank you.